Dr. Hugh Beatty, MD, widely recognized as the Wellness Doc, or TWD, is a distinguished physician with over 36 years of experience in fields of anesthesiology, pain management, and anti-aging medicine. Based in Bakersfield, California, he has built a reputation as a healthcare innovator, offering personalized and holistic treatment solutions to improve patient outcomes. His expertise in functional medicine, coupled with his commitment to advancing medical care, has positioned him as a leading authority in his field. Dr. Beatty's medical journey began with a Bachelor of Arts in Chemistry from Occidental College in 1981, followed by his Doctor of Medicine, MD degree from the University of California, San Diego School of Medicine in 1985. His passion for patient-centered care led him to specialize in anesthesiology, earning board certification from the American Board of Anesthesiology. Over the years, he expanded his practice to include pain management and anti-aging medicine, recognizing the need for comprehensive approaches to health and wellness. Since establishing his private practice in Bakersfield in 2000, Dr. Beatty has been at the forefront of integrating functional medicine into patient care, tailoring treatments based on resolving inflammation to achieve wellness. He's a member of the American Academy of Anti-Aging Medicine, and he remains dedicated to advancing medical knowledge and improving patient care. I mean, there's so much more here, doctor, but let me finish it because it's so important that they know about it. In addition to his clinical work, Dr. Beatty is an accomplished author. We need to let them know about that for sure. His book, 5 Pillars of Health, Do You Want to Be Well? It was published in 2024, reflects his holistic approach to medicine, emphasizing the importance of proactive health management. His ability to communicate complex medical concepts in an accessible manner has further solidified his role as an influential thought leader in the healthcare community with expertise in pain management, anesthesiology, and anti-aging wellness care. Dr. Beatty continues to impact the medical field through both his practice and public speaking engagements. His dedication to personalized and preventive care underscores his belief that individuals should take an active role in their health by combining cutting-edge wellness care with a patient-centered approach. Dr. Hugh Beatty remains committed to empowering individuals on their journey to optimal wellness. Ladies and gentlemen, on Front Page, Radio Free 102.3, welcome Dr. Hugh Beatty to Front Page. Let's go. No love? I'm just saying, give him some throw. Okay. Dorian's slow with the hand claps, but we had to.
You know, we've updated our system, so it's throwing me off.
Doctor, first and foremost, how you doing this morning, King?
I'm doing great. Appreciate you having me on, Danny.
Oh, it is an honor and a privilege to have you on. Look at you, man. You know, is that why it took you a little bit to get on? You looking all suave and smooth this morning? I'm watching them on Google Meet, for those that don't know. You looking smooth for 5 o'clock in the morning, man.
I got to keep up with you, man.
Oh, you better stop right now. I'm looking busted right now. Come on. Hey, first of all, I like to start my interviews with the same question to break the ice. You know how we do. You and I got history. Give me your 25th letter, which is, what is your why? Why do you do what you do?
I do what I do because I think this is a calling I got from God. Mm-hmm. And I didn't realize that because, I started off in chemistry and I ended up as a doctor.
Wow.
And then I kind of I thought I was searching for what I wanted to do, but I found out that God got me right where he wants me to be. Ooh. And I have a passion more for what I do now than I ever did. There's no other field of medicine I have a passion for. I think about it. I read about it. People ask me to speak different places. I jump right on it, and I'm still going. Even though I'm 66 years old, I don't know when I want to stop doing this because I love it. I love seeing people get well.
Dorian, go on and say it because I saw your reaction when he gave his age.
Ain't no way this man is 66 years old.
Right?
If they could see this man.
That's what I'm telling you. If you see, I'm telling you, Dr. Hugh Beatty practices what he preaches. Because if you guys saw him, I'm going to post this picture on our socials after the show. And I'm telling you, this cat looks like he's 45 years old. You could, if somebody said you 50, you'd believe it.
Yeah.
I've had situations. One time I was coming back from a trip abroad in the LAX, and I saw this black gentleman. He was helping with my luggage. And I said something to him. He said, man, you're not as old as me. And he was 52. And I told him I was 65. He couldn't believe it.
Yeah. So see that? You practicing what you preach. And let me I just said we got personal history. Years ago, you remember the conversation. He came on my show, my former show, back in my hometown. And he gave me a list of nutrients and vitamins that I needed to take. And you guys should see my shelf at home. I have lived this, I'm telling you, religiously from the moment we had that conversation. Iodine, B-complex, berberine. By the way, that berberine had your boy boo-booing. I'm just
Berberine got you boo-booing.
I need to restate that to boo-booing. I'm just keep it. Are we gonna keep it a buck up in here? Or what?
Do it.
Magnesium, 1,000 milligrams. All right. I didn't take that CBD oil. Well, maybe we'll talk about that. Probiotics, vitamin K2, and chromium. Is there anything I'm missing?
Yeah, the list got a little bit more extensive since then.
Well, give me some real quick. I'm typing. Give me some right now so the audience can also join in. Give me some other nutrients some vitamins I should be tossing into my body every single day.
Well, I'll hit you with the selenium. Selenium is critical. You didn't mention that on the list.
Why is selenium so critical?
Because we're going to talk about that today, heart health.
Oh, look at you.
It's critical for heart health, not only for the heart, but also to detox mercury in the body. It goes in there and scavenges it from all the tissues, the bone, the brain, the heart. And so it's called a selenoprotein. And it's a very potent scavenger of mercury. It binds very tightly to it. But also, you can have congestive heart failure just because your selenium levels are low.
Ooh.
Okay, and I've seen that. I had a patient that had very low selenium levels, and we put him on selenium, and it corrected his heart failure.
Wow, it corrected his heart failure, you said?
Well, I got information back that he went from a low ejection fraction up to a normal one. So, but that was coming from his cardiologist. So my thing is that I never know what's going to help a patient. Mm-hmm. I just start giving them what they need. I'm amazed as much as the patients are amazed when they get better.
Wow.
And that's why I love doing it, because I can't think of any other practice I ever did. I mean, anesthesiology is satisfying because, if the patient wakes up, you did a great job.
Yeah, I'm saying, you got some success. If they're still living, doctor, yeah, I'd say you're doing okay.
Yeah. But there's nothing more satisfying to help people who had chronic diseases. All of a sudden now they're doing so much better. It's amazing, man.
Wow. So, okay, selenium, is there a certain dosage I should take? Is there milligrams? Is it come in capsule form, liquid? What should we get?
Well, the healthy form is from Brazilian nuts because it's going to be in a bioactive form.
Okay.
About 3 Brazilian nuts a day is all you really need. You need 200 micrograms a day.
I can't take it by vitamin, no, doctor? I mean,
you can take a vitamin. I take selenium by capsule every day.
Capsule, there you go. Is there a certain, what's the dosage?
200 micrograms.
200?
Dose.
Gotcha. Yes. I'm writing that down right now. I don't know about y'all. We're talking to the wellness doc, Dr. Hugh Beatty, right here on Front Page with Tara Star Tucker, Radio Free 102.3 KJLH. Now, let's start with the obvious question out the gates, which has to do with our genetics and biology of the black man. Now, are we preconditioned? And you see a lot of it on TikTok, a lot of conversations happening on podcasts these days. Are we preconditioned as black men to suffer from heart disease, high blood pressure, and diabetes?
Well, I would say our epigenetics is predisposition to that.
Okay.
Because we put so much emphasis on our genetics. Genetics is only about 20% of what's going to happen to you. It's really the epigenetics. And what that means, just the environment you put those genes in. And the thing is, though, is that I'm reading some good information right now talking about even our thoughts create proteins in our cells that can be pro-inflammatory.
Did you say our
this
thoughts?
Is pretty deep. Our thoughts themselves.
Wait, THOUGHTS. Man, can I buy a vowel, please? How does that work?
Well, neuroscientists are showing this. Now, I know you're a godly man, and Scripture clearly says that. So as you think in your heart, so are you. So you can think and become unhealthy. And studies are showing that. The neuroscience, I don't know how they do it. I haven't really gotten to the medical part of it, but the lady I'm reading, she's talking about this. And so when you always have a negative thought, you actually produce proteins that are pro-inflammatory at the DNA level.
Wow.
They have shown that with your thoughts, your cell actually can retract. Certain genes on the DNA are not going to get read by the messenger RNA. Okay, and so the thing is, our thoughts are even important, whether we do well or not. So I'm starting more and more to have patients that think more about their thought life. So it's not just physically what you put into your body, it's what you think about and dwell on. You can actually, but for years we've known that stress can lead to illness.
Yes.
Okay, but why is that? Because you're thinking stressful thoughts. You're ruminating, you're worrying, things like that. And we already know you shouldn't be worrying anyway. But if you go through, we all going to have struggles and trials. It's what we do with those struggles throughout. How do we think about it? Do we think that we're going to get over this or not? And I've had patients that I couldn't help physically until their thought life began to change.
God, I've never heard that before.
Yeah, it's thoughts. You look it up. It's critical.
Wow. I can tell you being down here in Los Angeles, you know, and walking the beaches of Los Angeles.
Yes.
Yeah, the thoughts do lead to, you know.
Yeah. But I think, you know what? I think that ties into
There's some inflammation that happens in a certain part of the body.
No, for sure. You know, but I think that ties into, you know, mental health.
It definitely
yeah,
does.
absolutely.
You know, like I would solely agree with the doctor. Like you are what you think.
Yes.
You know what I'm saying?
Mm-hmm.
And that's why you say, like, if you're constantly thinking ill thoughts, you're going to become ill.
Yeah.
Yes.
That's real talk. Man, all the conversations we've had over the past few years, is this a new strategy of yours? We've never talked about the mind and how it produces protein and such. Where'd this come from?
Because I love to learn. And that's why I love what I do, because it's so fascinating, man. We're skillfully and wonderfully made. There's no way I will ever comprehend what's going on with this body. I think it's laughable when we think we know it all. So the person doesn't know is humble enough to keep researching and reading. I get information from my patients all the time. Doc, are you aware of this? Did you read about in fact, the book I'm reading right now was given to me by a patient. And I've been reading like I'm just totally blown away. But guess what? It goes back to other things I've learned. There was already a foundation there. That's why I knew it was credible. And then also because of my understanding of God's word, I knew it was definitely credible. So God is not trying to catch up with science. Science is trying to figure out what God has been saying to us.
Preach.
And so there's other things I can tell you about the link that I'm blown away when God has already made it clear. Like even the concept of don't mix wool with linen. There's a reason why. They both vibrate at a frequency of 5,000. But if you wear them together, they cancel each other out. And we need frequencies to give energy to the body. That's healing. So when I'm reading these things because I look at it, how it's going to apply to me as a patient. So you guys tell me, oh, doc, you look great. Yeah, because I take this information and I'm the first patient. If it's good enough for me, I know it's good for the patients.
I'm talking to the wellness doc, Dr. Hugh Beatty, right here, front page of Dark Star Tucker, Radio Free 102.3 KJLH. I wasn't going to talk about it, but you brought it up and brought it into the conversation. I have to, because one thing that I've been fascinated by you, and you don't hear from a lot of doctors, you love the Lord.
Oh, yes, definitely.
You are all about that life.
Oh,
and,
yes.
you know, a lot of doctors are about that science, though. You, my friend, you wear your faith on your sleeve while you're also helping people heal themselves. Talk about how a doctor like you can also lean on his faith. And I also want to know if you introduce that to your clients and patients that come into your office.
Anyone who comes into my office at some point going to hear me say something about God and how it's going to impact them. Because that's why if you look at the very top of my book, love is up there. And my editor made that love bold. Because God is love. And understand that if we don't love ourselves, then how are we going to love other people? So you first have to say, hey, what is in the best interest of me? And then what's in the best interest of patient? Because I love God and God loves me, I love my patients. So I'm always looking out what was best interest for them. That's why I keep studying. That's why I keep going. And so without love, I can't do anything. Without God, I can't do anything. Science means knowledge that comes from where? From God. And so I truly believe there's times when I'm sitting back and amazed because God has inspired me to look at certain things and do certain things that benefit the patient. So I'm in amazement with the patients. And I think because of that, he keeps blessing me. He sends patients my way that have been to doctors who could not help them with chronic illness. And then I just go through the process of trying to find why they're inflamed. And I do what needs to be done. And then the patients, it's just amazing. I went to church on Sunday and this guy saw me, one of my patients, he came up to me and just hugged me for 5 minutes because he had been suffering for 2 years, no energy, had no desire for life. And now within 6 weeks, he's already doing fantastic.
I'm not surprised. You do amazing work. I think transformational, groundbreaking work, personally. And you brought up inflammation, and that's a perfect segue to my next question here. What initially brought me to you is your conversations that I would see you have on gut health and being and being inflamed. And when people see someone that is overweight, you just assume that, oh, he eats a lot, he doesn't take care of himself, et cetera, et cetera. And you called it inflammation. Can you, for our front page audience, break down how that works and what inflammation is all about?
Well, first I want to set the foundation that inflammation causes 98% of all illness. So that should hit you with the fact that we could do something about it. And so inflammation is a choice, whether you want to be inflamed or not. Okay, so inflammation generally starts in the gut. Hippocrates said over 2,000 years ago that all illness stems from the gut. And I have had the privilege of seeing patients when their gut goes, they go down quickly.
Mm-hmm.
Okay, and so you'll know when you're inflamed. A sign of inflammation is just obesity. So when you have all this extra adipose tissue, that's inflaming to the body. It's full of senescent cells. Senescent cells are cells that are there existing and not doing anything functioning beneficial to the body. It's just taking up space, but it's making pro-inflammatory substances. And that inflammation leads to the body expending a lot of energy to deal with it. Think about it. We need energy. When patients don't feel well, they say, Doc, I'm drained. I have fatigue. So when I know that the patient has energy, I know they're on their course to being well and they're already well. So inflammation is very draining to the bodies. That's the first thing. So now the immune system can't work properly because it's too busy dealing with all this inflammation. So that's why you start seeing autoimmunity in people. When inflammation comes, people think inflammation is just joint problems. My back hurts, my knees hurt. No, inflammation is also the fact that you have diabetes and hypertension. You can't think straight. And it can be as subtle as I can't sleep, I have brain fog, my mood swings. All this stuff is signs of inflammation.
See that? See, Dorian, you didn't know that, right?
No.
I didn't know that either years ago.
And I'm sitting here in shock.
Yeah.
Like,
there's more to it. You just assume somebody is, we say fat, of course. I don't even like the term fat, but obese or just out of shape or whatever. The doctor breaks down exactly why and what you can do about it. I don't know if I've ever talked to you about, I do a cleanse once a year. I go to GNC and get one of those cleansing kits, and I don't leave for the weekend. I ain't going to get into details. Listen.
You right there.
We talking about berberine? Listen. Okay. I can fuel the space shuttle in my bedroom. But we ain't going to get into details. I don't want to get too specific. It's the morning. But do you believe in cleaning agents that you can get from any of these places like your GNCs and your health food places? Do you believe in cleansings?
Yes, but the best natural cleanse you can find right in Scripture, it's called fasting.
Ooh,
if we would just fast, we would get the cleansing that we need.
Speak on that. Come on, speak on it.
Everything we ever needed is right there in Scripture. Okay, because think about it. When you fast, I was just telling someone this the other day. When you fast, your body goes through a process called autophagy, which means self-cleaning.
Wait, say that one more time.
Autophagy. AUTOPHAGY.
Oh,
okay, that's a process of when the body, when it only takes place during fasting.
Mm-hmm.
So now, because your body is not getting more energy in the form of food, then your body is trying to preserve energy. So it starts doing a lot of house cleaning.
Mm-hmm.
It starts getting rid of senescent cells and dead cells. It becomes more efficient in protein synthesis. What should be synthesized? What should not be synthesized? And that doesn't take place until you do a fast. These intermittent fasting are what we call time-restricted eating. That's good, 12 hours. But I'm talking about a 2-day fast, 48 hours, a 72-hour fast. The body really goes into cleansing.
72-hour fast, though, doctor?
And people do that. The things you have to do it under, the monitoring of physician, the direction of physician. And I'm not saying don't drink water. You got to drink water. But what you really want to do is get that ketosis going. And you can't get that if you're eating. Because so many people talk about ketogenic diets. You don't need a ketogenic diet. You can get into ketosis by just fasting. And then it activates stem cells. People talk about, let's go get some stem cells. We can't do IV stem cells here in the United States, but we can do stem cells injected into joints. But the greatest creation of more stem cells is just fasting. It's amazing.
God, I have fasted for a day or two. Okay, 72 hours just seems like it's a little too much, though. You know, 70. You're saying nothing but water for 72 hours.
Well, you can hydrate because you don't want to eat anything beyond that. Just hydrate. Make sure you stay hydrated. Make sure you get your electrolytes. Things like that. You might find the first 36 hours you're really drained, and then your body kicks in and it starts adjusting to it. But I wouldn't go beyond a 72-hour fast. I know people talk about going longer. I don't necessarily think the body needs that. It's like everything's in balance. Okay, there's a time for eating. There's a time for digestion and excretion. There's a time for sleeping. And what we do, we just throw it all off.
Right.
There's just chaos in the body. We wake up in the middle of the night at 2 and let's get a snack since I'm awake. And the body never has a chance to go through its 3 phases. I call it the 3 phases of the body, where you spend a window of time ingesting food. Then let the body digest it, absorb it, and everything else it's going to do it. And then give time for excretion. When you wake up, think about what happens. People got to blow their nose. They got to they got to defecate. They got to urinate. Okay? We got to expectorate. All the H you want to put in there. Okay?
You got bars this morning. Look at that.
Natural. They're natural.
Gotta excavate and mediate. You better regulate. You know what I'm saying? Go on there, doctor. Is this Dr. Hugh Beatty or Dr. Dre? I don't know which one we got.
Well, we both from Compton.
Yeah. Oh, are you from Compton?
Yeah,
I didn't know that.
Compton. I graduated from Compton High in 77.
Wow. We're talking from Compton's own Dr. Hugh Beatty, TWD the Wellness Doc, Radio Free 102.3. KJLH. You know, you brought up sleeping, and I told them on the air yesterday, people were surprised when I said at a couple DMs and saying, you sleep only 2 to 3 hours a night? And I said, yeah, and that's on a good night. Do you believe in melatonin? And how do you get sleep if you can't sleep? My body, my brain won't allow me to. So for those listening that have struggles with their sleep, what do you recommend?
I'm concerned about your brain health as you get older.
Yeah, man.
Because if you're only sleeping 2 hours a night, guess when the brain actually goes through its purge of all that inflammation you built up during the day. Understand, when you have cellular activity going on, what we call it the redox system, reduction oxidation, well, there's some inflammation going on too. And when you sleep at night, everything begins to restore itself. That's when you can clear out all that, what we call tau and amyloid, beta amyloid you've been creating during the day. Okay? And so the brain has to purge the inflammation. And if you're only sleeping 2 or 3 hours a night, not only that throw off all your hormones, but you're not dealing adequate brain inflammation. So there's going to be certain things I would want to do is first get you to sleep better.
That'd be nice.
But I would also recommend certain things that will help protect your brain too. And one of them is glutathione. I was going to tell you something about glutathione because you said, what other things are you doing? Because I have a whole IV therapy business now called the Wellness Water. And we're doing certain things now with NAD and glutathione. I do a lot of ozone, which is great for brain health. So I would be concerned about that for you.
So you don't believe in melatonin, it sounds like. Is that?
I do believe in melatonin. So let me get back to that. Melatonin is very important for the brain from the pineal gland. But understand something. And when you take exogenous melatonin, it's not going to get into the pineal gland. That's a different story. But melatonin, what people don't realize, comes from serotonin. And 80% of the body's serotonin is in the gut. There's a gut-brain connection. So that gut inflammation can lead to brain inflammation. But here's the thing. But serotonin comes from tryptophan. So that's when you eat turkey, you feel like you're drowsy. I think you're drowsy for a lot of different reasons after Thanksgiving. You overate, number one, and you got that tryptophan. So here's the link. Tryptophan makes serotonin. Serotonin makes melatonin. So it's not unusual when people get depressed. We're talking about mental health again. When you're depressed, your serotonin stores go down. Okay? And so that impacts your sleep because serotonin is making melatonin. So it's not unusual when I have patients who are suffering with depression. One of the things I do to get them to not have to give them a medication like what we call the SSRIs, selective serotonin reuptake inhibitors. Okay, I'm not going to name any names, but those SSRIs, they block the reuptake of serotonin at the neural junction. And so you can get the same effect by giving them tryptophan or 5-HTP and melatonin at bedtime. That will increase their serotonin levels naturally. They won't be depressed and they'll be able to sleep. So everything that you think about giving a medication for, there's a whole functional medicine approach to give it. Wow. In fact, I just had someone that had been on meds for years. She got off her last medication because of a functional medicine approach. And it's amazing. She had been on me for a while. Can I stop this last med? I said, we'll take a look. Let's follow you. But when I'm saying I see it, I'm amazed because I see it all the time. Give the body what it needs. It heals itself.
Oh, wow. That right there. Dorian, I don't know what you're talking about. You don't sleep either. You sleep more than me. Aren't you sleeping like 4-5 hours a night?
I get about 5. Well, with my schedule for this week, I try to get about minimum 6 hours if I can.
Yeah.
But I actually want to ask the doctor a question because touching on melatonin, do you believe that there is a certain age limit to give melatonin towards? You know what I'm saying? Like, is melatonin okay to give it to a child, or do you recommend it for someone of an older age in their adulthood?
Well, the first thing I would think that melatonin, I looked it up. It's not really necessarily recommended for children. But the thing is, though, children should not have a problem with melatonin. I don't guess, I test, because if I guess, be ready for a big mess. So I measure
bars all morning.
Right? I'm just waiting for him to drop an album.
You know what I'm saying? He look like he on the album. He looking like Luther Vandross right now.
Never too much.
I don't want to be a fool. All right. You were saying, Dr. Dorian and I are goofy this morning.
The critical point I'll make about melatonin, since you brought it up, it's in circadian rhythm with, guess what? Cortisol, the stress hormone. So the thing is, your cortisol levels need to be low at bedtime, and your melatonin levels are supposed to spike. They're supposed to be the highest of any time during the 24 hours is when you're trying to go to sleep. And then in the morning, the cortisol jumps up and the melatonin goes down. So that's the circadian rhythm. So I'm looking at these cortisol melatonin curves all the time. And a lot of time, it is the whole reason why people can't sleep. So when I start correcting and giving them melatonin if they need it, and also giving them the tryptophan or 5-HTP, you get the serotonins where they need to be. Serotonin is the chill hormone. It's the happy hormone. So these things are fascinating. You mentioned I was a chemistry major in college. Man, I blew it. I should have became a biochemistry major, but I didn't know. I wanted to be a chemist. I was like Poindexter growing up, man. I wanted to mix chemicals. And I ended up in medical school because I worked at Dow Chemical one summer back in 1979. And after working there, I said, no, I'm a people person. I want to go to medical school. And that's how I ended up in anesthesiology. But biochemistry, where it is, because the more you understand what's happening in the cell, the better you can go ahead and impact those pathways.
Very, very nice. Very nice. I wanted to ask you about screenings, too, by the way.
Yes.
By the way, you mentioned circadian rhythms. I hadn't heard that until Kendrick Lamar dropped it on his album. He mentioned the phrase, and here you are talking about it. You must be a K-Dot fan. Is that what we're doing here? You trying?
Yes, of course.
Of course. Compton. That's right.
Again.
Dr. Hugh Beatty, Dr. J. So what screening should we black men be getting based on our age and family history or background? Like if we go to see you, doctor, which screening should we get?
Well, everybody's always concerned about prostate cancer and colon cancer.
Yeah.
But also there's heart disease, and you need to be concerned about kidney disease because that's really a problem in the black community. But here's something. When people are concerned about cancer, I said cancer is an inflammatory illness. So instead of screening to see if we have it, say, "Woo, I don't have it this year. Let's see what happens the next year." No, let's get proactive. Let's get out in front of it. Let's get the inflammation down so we lower our risk of cancer, the colon cancer, the prostate.
Well, hold on. I want you to continue. But are you telling me that the heavier you are, the more likely you are to develop cancer?
Yes, men and women. It's studies that show that. Because think about why that is. Remember, all these adipose tissue, senescent cells and things like that are inflammatory, pro-inflammatory.
Yeah.
And cancer is an inflammatory illness.
Mm-hmm.
Plus, in addition to that, the bigger you are, the more estrogen you make. And estrogen is a known cancer-causing chemical since 2003. It's been known for the last 50 years that estrogen causes breast cancer.
Estrogen causes breast cancer?
That's crazy.
Yes.
Never heard that before, Dorian.
Look it up. And now it's never mentioned. That's why I'm mentioning it here. So there's 3 different estrogens that the body makes. It makes not only estrone, estradiol, and estriol. Estrone is the one that develops the cancer-causing metabolites, like 4-hydroxyestrone, 16-hydroxyestrone. So I go ahead and I test for those. I check for those on patients before I even start hormone therapy on them. So understand, the bigger the belly, the lower the testosterone. Why is that? Because testosterone gets converted to estrogen in belly fat through an enzyme called aromatase enzyme. So when I see people walk up to me and they have this big belly, I already think estrogen dominance. I'm already seeing the link that they're inflamed and the link to cancer. So what I would start doing, I start getting them on that 5-pillar health approach. Look at their hormones, clean up their gut, try to impact their nutrition the best they can, try to get them to sleep, because sleep can lower your inflammation, and then get them to start lifting weights, because muscle will burn calories even at rest, as you know.
Facts.
Because I know you're very fit.
Well, I wasn't going to say nothing, doctor, but it is
worked out before we got on the show.
I wasn't going to say nothing, but absolutely.
I walked in, he was doing push-ups.
Doctor, for years, I learned when I turned 30, I don't want to make this personal, but when I turned 30, I looked at my family and I'm like, I'm not going to be this, because my family is about, Southern food, being big. And if you are trim, when you walk in the building, they say, boy, you need to eat something. You're like a little too trim. And all of them over there, and they're just grubby. I'm like, I'm not going to be that. I don't want to die at 55. I don't want to do it.
I agree. And see, here's the thing. You're a classic example. If you go to a traditional physician and you get on his scale, he's going to say your BMI is over 30. Yeah. Because you're full of muscle.
Yeah.
And so that's why I don't focus on that. I focus on the fat to muscle ratio.
Thank you for saying that, because I think that BMI chart is garbage.
It is garbage.
I'm supposed to be 187 pounds. Yeah. It's like,
look at your height and weight.
My doctor here, he tells me, according to the BMI, I'm supposed to be 187 pounds because I'm 6'1". No. And I'm like, I would look just terrible. I could hula hoop in a Cheerio with 187 pounds.
No, you just need to keep that fat percent under control.
Yeah.
And for men, it's between 11 and 21%. So if you're in that fat percent around that range, you're good.
Nice.
Okay.
Here's a question out of left field. Are all black people vitamin D deficient?
All the ones I measure.
All of them?
All the ones. I had one guy, he was almost 0.
Wow.
Okay. But I do something else called an intracellular scan, where I confirm it. Not only look at the blood level of vitamin D, because that can fool you. Patient can take vitamin D about a week before he comes in. His blood vitamin D might not be that low. It might be 10. That's still lower than the therapeutic window. I think minimally it needs to be 30 in the blood. Mm-hmm. I shoot for 60 in patients, up to 100. But when I look at the intracellular scan, that's what really makes the difference. What is it at the cellular level? That's like having a full tank of gas, but you got a faulty fuel injectors. It's not getting to the engine, the fuel. So it's the same thing. You can take vitamin D, but is it getting to the cell where it's needed?
I read an article a few years ago. You got a question, Dory?
Oh, no.
I read an article a few years ago that said that a lot of the supplements that you get for vitamin D over the counter, they come right out in your urine. They don't actually saturate into your bloodstream or your body. How do you determine? You don't agree with that?
I don't agree with that. I agree with water-soluble vitamins like vitamin B12 and the B complexes. The B vitamins, like vitamin C, all those things that are water-soluble, they will come out. But once you saturate the cells, because the body is very amazing. It wants to purge what it doesn't need. That's why I do a lot of urine studies on things, on hormones and on vitamins, things like that, because I want to see, are you taking more than you should? That's why I look at the cellular level. The blood level can really confuse you and fool you because of the fact that you can overdose a patient based on looking at the blood. You can underdose a patient based on using blood, especially when it comes to something like, I know you're not talking about testosterone, but that's a big problem in men. Men go and get their testosterone level checked, and then they get treated for something that they don't even have an issue with. You got to really do forensic accounting on that to start. Look at the saliva, which is the cell representation. Look at the urine, which means is excreting testosterone in excess or not as much. And look at the blood. But getting back to that, vitamin D is a fat-soluble vitamin, okay? Mm-hmm. And you're not going to excrete it in their urine like that.
Right.
So when you take vitamin D, I've had patients that have higher levels of vitamin D because they know that I push vitamin D. But I tell them, I said, once you get beyond a certain range of vitamin D over 100, there's really no need to take more. So most of my patients take 5,000 to 10,000. And what I find,
10,000 milligrams of vitamin D?
Yes, 10,000 IUs, international units of vitamin D.
Okay.
So 5,000, like 125 milligrams.
Okay.
But the thing I want to point out about the vitamin D that's critical is this, that vitamin D is made from cholesterol. People don't know that. Vitamin D is really not a vitamin. It's a hormone. It's really a pro-hormone. And it impacts every cell of your body. Mm-hmm. And so the reason why I want to take it's made from cholesterol, because the way it does, if you're out in the sun, the sun, the UV rays of the sun penetrates your skin to get to where the cholesterol is to convert it to vitamin D3. You understand?
Yeah.
And so the thing is, if your skin is darker, it's not going to be as effective. And so I advise all my patients of color, darkest pigmentation to take vitamin D. I measure the level, and they're always a shock, especially when they say, Doc, I'm in the sun all the time. I say, yeah, but your vitamin D is 8.
We're talking to the wellness doc, Dr. Hugh Beatty, Radio Free 102.3 KJLH. This is a front page with Dara Star Tucker. Let's continue here. Since we're talking about, some of the myths associated with our people. Is it true? Because it seems like to me, all of us are lactose intolerant. Is that true?
I wouldn't say all.
Is it a high percentage?
Well, I would say a high percentage. And so that's why people are, trying to do that lactate and stuff like that.
Yeah. That's just terrible, by the way.
Lactase is an inducible enzyme. So if you introduce dairy into your gut, the enzyme will increase. And so you can tolerate it better. But the issue is not lactase deficient or lactose intolerant. The issue is, why are we doing dairy? Because dairy is inflammatory to the gut. All this cheese, all this milk. Man, milk is for cows, okay? So, and then what's in that milk? Yeah, they fortified with vitamin D. I think that's a way to get you to drink milk, because you can get vitamin D from other sources. They fortified with calcium. We have way too much calcium in our diet already. Calcium causes our blood vessel to contract. It can lead to hypertension. It can lead to kidney stones. It can lead to increased calcification in the coronary arteries. So unless I measure people's calcium level at the blood as well as the intracellular level, I don't really recommend calcium. We need magnesium. Magnesium neutralizes calcium. We need potassium. Potassium neutralizes sodium. We get all this sodium in this processed food. So we walk around with blood pressures high. When I start balancing out the sodium with the potassium and the calcium with the magnesium as is needed, guess what? The blood pressure come down, their pulse rate come down, they have less restless days, they think clearer. It's amazing. Put things in balance where it should be. We're making everything out of balance, and we can't understand why we have all this illness. So getting back to your question about lack, I think the better question is, should we be doing dairy? That's the issue.
Is he cooking or what? Or Dorian, is he cooking or what?
No, he's cooking for sure.
I'm telling you, man, he's cooking. Let's take a break right now. When we come back, though, I want to ask you, first of all, we're going to talk about that book, because you have a fantastic book that I want people to cop as soon as they can. All this information you guys are getting right now on front page, that book is a brilliant book. I want you guys to hear about that in a second. I got a few more questions for you as well. And don't forget, we're also still taking phone calls. 310-520-KJLH. 310-520-KJLH. We're talking to the wellness doc, Dr. Hugh Beatty, right here on front page with Dara Star Tucker, Radio Free, 102.3 KJLH. Stay there.
Here's Dara Star Tucker.
Here's Danny Morrison in for Dara Star Tucker. This is Radio Free 102.3 KJLH. We're having a conversation on men's health today. We're talking to the wellness doc. That is Dr. Hugh Beatty. We were having a conversation prior to the break there. We were talking about milk, and we were talking about testosterone. You wanted to expound on that topic a little bit more. You say milk lowers testosterone. Am I saying that right?
Yes, a glass of milk, because it has estrogen in it, can lower testosterone. And I remember when I read that in a book, and I had to do a little research on it, and clearly it can. It's a transient lowering, but it can. So when people are always thinking about, hey, I want my testosterone levels to be where they need to be, then consider that. But does it really impact it at the cellular level? Does it cause it to excrete more testosterone in urine? Because the studies didn't talk about that. It just talked about in the blood. But if it drops it in the blood, then guess what? It's going to impact the cells. But I just don't do dairy as much as I can. Now, I love ice cream. Don't get me wrong. Okay, I will do that a couple of times a month. But other than that, I haven't had a glass of milk. I can't remember. And I haven't had milk way before I found out about the testosterone estrogen link. But I just don't think you need it. I don't do that milk and Oreo cookies anymore.
Cinnamon Toast Crunch? You don't rock with it?
I try to stay away from all processed stuff right now. Boxes, if you can read it on the label, don't eat it, man.
Frosted Flakes? You know what I'm saying? Hey, we only got a few more minutes. We got to talk about that book. Please, doctor, tell them about the fantastic book that you put out a little while ago and how it can enhance their, look at you, showing it on screen.
Show the book.
The 5 Pillars of Health. Break down that book, doctor.
The 5 pillars of health. These are pillars. When I encounter a new patient, I always question where they are on these pillars. I go through a sequence and ask them about their hormones. I ask them about their gut health. I just look for signs and symptoms of that. I ask about their diet. I ask about their sleep pattern. And then I ask, do they work out? And when people are hitting on all 5 cylinders, it's like having a 5-cylinder engine. If you're hitting on all 5 cylinders, then you're going to do very well. And then water is so foundational. We're 70% water as adults. And I encounter people don't drink enough water. They don't realize you need to drink half your body weight in ounces of water every day.
I drink water all day, every day. I drink a ton of water. But some people say you can drink too much water, though.
Well, you can if you don't drink enough electrolytes with it. That's the problem. You can actually die from overconsumption of water. I remember I think it was a radio show contest about water consumption, and the person died. And so after that, I think it was up in Sacramento. You may have heard of that. It was probably about 20 years ago. So that's why it's good to look at your electrolytes. You just don't consume water. When I give IV hydration, even as an anesthesiologist or even now, we don't give water, free water in the IV bag. We have salts in there. It's called lactated ringers. It's called sodium chloride. So you have to be electrolyte neutral. And then that way the brain doesn't swell. The problem is that the water goes into the cells and swell the cells in the brain. And now your brain doesn't have any room to expand. And so you can go into a coma and die.
Doctor, we got 30 seconds here. I want people to know how they can get in contact with you. Do you have socials, website, or otherwise? And also where they can cop that book of yours.
Well, my book can be obtained on Amazon Books as well as Barnes & Noble. So if you just go on Amazon Books, just 5 Pillars of Health, Do You Want to Be Well? Dr. Hugh Beatty. I have an Instagram page, Doc in Back, because I'm a doc in Bakersfield now. I used to be called Doc in L.A. when I was in L.A. But anyway, those are the 2 ways you can find me. If someone wants to call my office, I can give my phone number to my office. It's 661-395-0315, and I can do a consultation on anyone who's interested.
I'm telling you guys, get down, make the trek down to Bakersfield and see this doctor. He is amazing. Dr. Hugh Beatty, the Wellness Doc, thank you so much for coming on Front Page this morning. God bless you, and thank you for changing my life. You changed my life and enhanced my health. So thank you so much for everything that you do.
All right. Thank you very much for having me on, Danny.
Anytime. The Steve Harvey Morning Show with the Day Lamar is coming up next. Good luck. God bless. Go on. Keep it on Radio Free 102.3 KJLH. Keep it there.
Hey, it's Tammy Mack. This afternoon at 5:20, you can stop the scrolling. I'm not trolling. I got you. I am talking about everything trending. Oh, I'm going to hip you to the T. What's the T? You know that's me on Radio Free 102.3 KJLH.